Hi, good afternoon, everybody, and welcome to Sarasota Bay Deep Dive interview number 2. My name is Darcy Young. I work for the Sarasota Bay Estuary Program in Sarasota, Florida, where our mission is to restore our bays, our estuaries between Palmasola Bay up in Bradenton down to the Venice Inlet in Venice. And we've started doing these deep dive interviews with members of the community, people who work in the environmental field, while we're all sort of working in quarantine and isolation. And the purpose of these interviews is to highlight our guests and how their work has positive impacts on Sarasota Bay and its watershed. My guest today for this second deep dive interview is Ramon Quintero, who is the Environmental Community Health Planner with the Florida Department of Health in Sarasota County. And today we'll be speaking about how environmental health and human health are really intricately connected to each other. And it's a super important topic, especially this week as we celebrate the 50th anniversary of both the first Earth Day in the United States, as well as the signing of the Clean Air Act. So I'm going to go ahead and loop Ramon into this conversation. Hey there, how's it going?
Pretty good, pretty good. Thank you for having me.
Absolutely. Thank you so much for joining me. So Ramon, I'll go ahead and just ask you to tell us a little bit about yourself, about your background, how you got involved in public health and environmental health in particular.
Yeah, so I'm from California. That's where I went to college. That's where I grew up. And prior to being in Florida, I worked for TNDC, which is the largest housing developer in San Francisco. It was basically a housing developer that had supported housing, and it had, we did a lot of community planning, environmental remediation around the neighborhood, and try to get people involved and basically having a stake in how their community looked and just to improve kind of community empowerment, but from a very people-based, bottom-up approach.
Great. Yeah. So now here in Sarasota, you're with the Department of Health as a community health planner. And, you know, I imagine you're doing some of the same things, but maybe you can tell us a little bit about what your job is now with the Department of Health.
Yeah. So one of my primary roles is to support the chats, a series of chats that we have throughout the county. And so I go to the chat meetings where I meet with local community organizers or organizations, either in Northport, Venice, or in the city of Sarasota, to try to coordinate policies, practices, and to keep the community informed about Florida health upcoming opportunities for people to engage. So that's one aspect of my job. The second aspect of my job is to build relationships with very specific neighborhoods that have challenges relating to environmental health, and so that we can work in improving the physical development and improvements of those neighborhoods. Like one of the neighborhoods where I focus is Newtown, and basically because we know that that neighborhood specifically has almost double the rate of kids with asthma. So we want to reduce that. And one of the ways that we go about it is we build partnerships with people that have been in the community for a long time and have been engaged with those same issues, so that we can create some synergy and build capacity, build relationships, so that hopefully we can improve the quality of life of those kids that live there.
Yeah, that's really interesting. I think those chats, it stands for Community Health Action Team. Did I get that right?
Yes.
Yeah.
Perfect.
Yeah. So those are such cool, community, really grassroots organizations that are built in those different communities that you work in. And it's interesting to hear you mention the asthma issues in the Newtown area, because the American Lung Association actually this week just put out their 21st annual, they call it State of the Air report. And it's their report on air quality around the United States. And, essentially what they're saying is, despite the fact that we have these Clean Air Act regulations and total emissions are really going down quite a bit in the United States since 1970, however, climate change is really exacerbating some of the issues we have in terms of increased heat. And in some parts of the country, we have a lot more wildfires now than we used to, for example. And so, I wonder if you could speak to maybe some of those challenges with air quality, not only specifically in the Newtown area, but kind of across Sarasota County in general.
Yeah, what we have is I'm a geographer by training, so I am an urban transportation planner. So one of the things that we have in Sarasota is that we have an increase in temperatures, and that has disrupted the flow of the air, usually like the marine air that comes from the Gulf, and so there's a lot of things that so even though the city of Sarasota is not like a major huge hub urban center, north of us, the city of Tampa is, and so a lot of the air pollution that's in the city of Tampa actually comes down to us because of these natural occurrences.
Right.
So I think a lot of people in Sarasota have the misconception sometimes that, oh, we're just a small city, so we don't have a lot of pollutions, but we have relationships to other cities that are nearby that actually have a large metro area, and we're not that far from them. And there's some other in the county. We're also growing at a very fast in South County, and a lot of the new developments don't have the connectivity to the jobs. So a lot of people have to drive long distances. So a lot of all that, and there's also like these legacy, like historical reasons, like why we have these situations where people have to live far away from jobs, and it has to do with basically we have a car dependent built environment. And some of my work is to kind of look into the next 20, 30 years. What type of city do we want to live? And so I think having those conversations with residents, it's important because people are making decisions based on, like, can I afford to live here? Where can I get a job? And we have the city of Northport, which is the largest municipality in the county, has a huge number of people that work in downtown Sarasota, but they can't live in downtown Sarasota. So there's all these questions about like the right to the city, access to housing, and all those things have negative effects beyond just the environmental, but like the social aspect of it. I mean, if parents can't be with their kids after they are out of school, that can be that's not a very good thing for families. So we try to look at things from a very holistic approach. I think in the Department of Health in Sarasota County, not just look at the natural environmental things that you can see, but also the things that are not the unseen things that people have to go every day. Everyday people have to go and overcome. So
yeah, those things that become kind of normalized for us, just because I think with a lot of us, especially, I've lived in Florida for about 5 years now, but you come and you're used to what's there when you move there. And so it's kind of, it's always a new normal. And I think one of the things that's so interesting about what you do and working on air quality and how communities are planned out is the effects that really has on water quality as well. And what we're interested in at the estuary program, because air quality and water quality, we don't think about it a lot, but they're actually really intricately connected with each other. I think a lot of us had kind of a view into that when we had our red tide bloom a couple of years ago that was very severe, how the water quality conditions were impacting the air quality conditions. And you can see we actually got a comment here from Jennifer who said, I know my asthma has been triggered by harmful algae blooms, so water quality is important to air quality and to human health, which I think is absolutely true. And the reverse is also true, in that when you have poor air quality with a lot of particle pollution, a lot of those fossil fuels being burned, and when those are in the atmosphere, they can make their way down into our waterways and actually contribute to nitrogen pollution of those waters. So I think it's really important to be talking about these things in tandem with each other.
Yeah, and land use planning is key to water quality. I mean, we have to have space where water can do filtration, where water can be replenishing underground aquifers, and so the environmental health side of the Florida Health Department, basically they're most of the people in my department are out there just testing the water. Like every day they go to the beach, they make sure that it's safe for people, and I think we have a challenge because as we continue to grow, we need to grow in a more sustainable way, so that as we make way for more people, we also make way for the environment to replenish itself.
Right. Absolutely. Yeah, it's such a difficult puzzle, but it's it's one we're lucky to have a lot of smart people working on in our community. So I'm wondering, we've covered a couple of these already, but I'm wondering if you can tell me, what are your main priorities for environmental and community health in Sarasota County? We've touched on a couple things with air quality and planning, communities where people can, maybe stay closer to home instead of having to go quite so far away for work. Are there other priorities that you're working on at the Department of Health?
Yeah, so another priority that we have is basically to be able to build partnerships with people like yourself, that we can build those relationships, because I think the face-to-face, and I know right now it's a challenge, right? But it's fundamental. Like everything starts from relationship building. We're trying to also have people that stay with us for longer term, because when you have a lot of turnover of staff, it's built to continue those relationships and to work in long-term projects.
Right.
So I think sustainability has to do also with not just the outward looking, but also the inward looking of the organization. Can the organization stay on task, for years to accomplish something? And I think as we look outward at making relationships, we also are looking inward in the health department, so that we make sure our staff are satisfied, are happy, and they're committed, and they're willing to stay for the long haul. I think sometimes when we think about sustainability, we think about just projects, because it gets us excited to talk about it.
Right.
But I think what goes behind all the work that happens behind the scenes, so like hiring the right people, keeping those people, I think is fundamental to the sustainability of any project that has to do with, especially the type of projects that we're working on, that we won't see the outcome till like 20 years from now,
Right.
if we do the right thing now.
Yeah, that is, I share that challenge with you, especially with community building. You're trying to inspire behavior change and things like that, and you may not see the impacts of those changes until far down the road. But I think what you said about that internal strengthening of the organization is really important. And I'm wondering if your background is as a geographer. If you were trying to give advice to somebody who was, who wanted to get involved in community organizing, community health, what would you tell them to focus on?
I think one of the primary things is just talk to your neighbors. Talk to there's everybody. Everybody is. We all have a stake on it, and I think to just be open about joining and asking. I think there's there are more people out there that share your concerns than what sometimes we think.
Mhm.
Sometimes people that are interested in sustainability issues feel like there's no community out there, or that their issues are not important, but they're they're really important, and there's a lot of people. Primarily that like not making an assumption of what kind of response you're going to get before you ask a question. I think it's being open
Mhm.
to building relationships. It's the key to like getting involved from the beginning, because that's how I get involved in in, in planning issues. It's like before I even went to grad school, I just thought maybe someone else cares about this, and I just and people were like, some people were like really open to uh, supporting what I was uh, advocating for at that in that moment. So I think it's just being open to building relationships is the key for anything. And even if you just focus on one thing, like your thing is just water, that's we need people to develop that expertise in that area. Or maybe you're more like me, that you're like you have very broad interests, go from like housing to like bike pedestrians to water to air. It's
Mhm.
fine. It's fine to be a generalist too.
Absolutely. Yeah. And I mean, you and I are served together on a committee actually that puts together the Sustainable Communities Workshop in Sarasota County every year. Actually, we have a meeting for that in about a half an hour, so I'm going to have to let you go pretty soon. But I think one of the great things about that workshop, which has been going on, it's going to be the 15th year of it, is just to see the breadth of sustainability and to bring people together talking about those issues and seeing that they're not necessarily the only person in the whole county who cares about it, right? Um, so,
Yeah.
with that, Ramon, is there anything that you want, any message that you want to get across in this interview, any call to action you have for our audience? Or should I just wrap up with our last question for you?
You can wrap up with the last question.
Okay. So, I think we're all looking forward to getting outside more as soon as we possibly can. And so I've been thinking a lot about my favorite spots outside on Sarasota Bay recently. And I want to ask this of every one of my guests on these deep dive interviews. So I'm wondering, do you have a favorite spot on Sarasota Bay that you're looking forward to getting back to?
Yeah, I'm lucky. I think where I live, which is just south of New College campus.
Mhm.
That's my favorite spot to go and just relax. It's a public college, so everyone is welcome. It belongs
Mhm.
to all the people of Florida. Uh, so I think people should take advantage and go out there and see the sunsets. Um, and because I think a lot of people that live in Sarasota don't even know the new college exists sometimes, surprisingly.
Mhm.
But it doesn't just exist. It belongs to you, and it
Mhm.
belongs to the people of Florida. So people can come and see the water and see the dolphins. I see manatees there. I mean, it's a very beautiful, and we're very just privileged to be close to it.
Absolutely. Yeah. I mean, I love it there too. And it's got some of the most gorgeous seagrass beds we have in the Bay are right there. So it's a really wonderful place to go see the Bay ecology. Yeah, absolutely. Well, Ramon, I think with that, we're going to go ahead and wrap up the interview. So I know it must be really busy at the Department of Health right now. So I thank you so much for taking the time to talk with us today. I really enjoyed thinking about the connections between environmental health and human health and community health. And yeah, I'll continue to look forward to working with you in the future. Thank you so much.
Likewise, thank you for having me.
Absolutely. And to our audience, that's going to wrap up our second deep dive interview. We're going to be back here on Thursday at 11 o'clock in the morning. We're going to be talking with Sheila Scalaro, who is the Science and Outreach Coordinator for Sarasota County Stormwater. And I mentioned those beautiful seagrass beds up by New College of Florida. Well, we're going to be talking to Sheila all about seagrasses on Thursday morning at 11 o'clock. So make sure to join us then with all of your seagrass related questions. I'm going to go ahead and throw up our schedule for the remainder of April so that you can get those down in your calendar. And we've almost got all of our May interviews booked now, so we're going to get that schedule up for you soon and hope we see you in May. So thank you so much for joining us, and I'll see you this Thursday.